Hi, everyone. I'm Governor John Carney. Thank you for joining us today for the signing of the proclamation recognizing October as Breast Cancer Awareness Month. We have a number of Delaware citizens who do an incredible job working with the Breast Cancer Awareness Coalition and doing great work across our state as we fight this terrible disease that has affected so many of our loved ones. And it is a cancer that we've been able to overcome in a lot of examples. And we have some of those women who are survivors that you'll hear from today. I want to thank each of them for joining us, particularly Francesca Vogel is the Deputy Executive Director of the Delaware Breast Cancer Coalition, and of course, Ciro Papiti, who's the board president, who's coming to us with the big pink insignia behind you. Ciro, thank you all for joining us today. And without further ado, at the end, after we hear from each of our guests and our survivors who are with us today, we'll have a reading of the proclamation in observance of Breast Cancer Awareness Month. We'll sign it, and then we'll have some videos today. We had a number of Delaware legislators who wanted to join us on the Zoom call today, and we could not accommodate that. So we will, at the end, have videos that are taped by each of those legislators who are so supportive of the efforts of the advocates with us here on the screen and others who work tirelessly across our state to fight this terrible disease. And so first up is the aforementioned Francesca Vogel, who's the Deputy Executive Director of the Delaware Breast Cancer Coalition. Francesca, thank you for being with us today.
Thank you, Governor Carney. The Delaware Breast Cancer Coalition and I are honored to be here with you today to commemorate October as Breast Cancer Awareness Month. As the Executive Director of DBCC since last September, it has been my privilege and honor to serve an organization that has helped women and men throughout Delaware for nearly 3 decades in their brave fight against breast cancer. I'm also humbled by the many courageous women who have allowed us to walk alongside them in their journey. Their unwavering zest for life inspires the work of our hands, minds, and hearts, giving personal purpose to the work we do every day in making a meaningful difference in the lives of breast cancer survivors. Breast cancer has not ceased because of coronavirus. Sadly, every 13 minutes, a woman dies of breast cancer. A year ago, the stark realities of a pandemic were unimaginable, let alone leading an organization through the unprecedented financial challenges it has caused for our agency. Yet what has become so compelling are the pronounced needs of our breast cancer survivors, who need us more than ever going forward in our new normal. Breast cancer diagnosis alone is a daunting reality and more than anyone should have to bear. Yet in 2020, as COVID-19 persists, breast cancer survivors have been devastated by increased isolation due to their immunocompromised health, elevated risk of viral infection, new financial challenges caused by job loss and decreased household income, delayed breast cancer treatment, and disrupted family lives. All of this has taken a tremendous physical and mental health toll on breast cancer survivors who have turned to the Delaware Breast Cancer Coalition, desperately in need of the support and programs our services provide. Heeding the call of survivors, the DBCC quickly transitioned to virtual delivery platforms for nearly all of its programs. DBCC facilitated online sessions for survivors, providing breast health resources and much needed social interaction and mental health wellness programming. In some cases, we experienced participation levels increasing as high as 250% over the same period last year. During fiscal year 1920, DBCC presented peer mentor trainings, added 12 new peer mentors to the 318 active peer mentors who provide one-to-one emotional support, research-based information to 138 newly diagnosed women. DBCC held over 317 survivor programs and activities serving 2,768 breast cancer survivors. Yes to Health, a 12-week program combining physical exercise with wellness education, was offered to over 1,500 participants throughout the state in over 196 classes. DBCC assisted 999 women with navigation, and coordinated 544 mammogram screenings through the Women's Health Screening Program. DBCC provided 193 women with interpretation in Spanish and Haitian Creole, and 95 with transportation to their screenings. DBCC reached over 2,200 people through community events and breast health presentations. And through the Breast Care Fund, DBCC provided over $70,000 in assistance to women diagnosed with breast cancer. Assistance addresses quality of life issues as well as emergency needs. While we have made significant strides in our efforts for early detection and treatment of breast cancer through our state contract Women's Health Screening Program, we cannot afford to let pandemic fears undermine the progress we have made throughout Delaware. Support for women's health screening must remain a priority as we re-educate individuals, especially in vulnerable communities, whose pandemic fears have caused them to delay or indefinitely postpone preventative screenings that may save their lives. Once again, we thank the governor for supporting our mission to increase breast health awareness and recognizing the work of the DBCC as Delaware's most trusted resource on breast cancer health. Thank you.
Thank you very much, Francesca, and thank you to the coalition for the work that you do on behalf of thousands of Delaware women, particularly your attention now, as you mentioned, to the challenges of survivors in the context of COVID-19 pandemic, where you have those compromised immune systems, your continued commitment to making sure that women can get their life-saving screenings, which is so incredibly important, in which our state, since the creation of the Delaware Cancer Consortium and others back in early 2000 by then Governor Minner, have been doing just an incredible job with the Division of Public Health and with the coalition partnership to get those screenings done. It's been a difficult time for all of us over the last 7 months, and certainly fears and anxiety among women who are survivors with these conditions. And so we thank all of you and your coalition for the great work that you do. The coalition is chaired by Ciro Papiti. Ciro, it's great to have you with us today as well.
Well, thank you, Governor. And at the onset, on behalf of our board, on behalf of our wonderful staff, some of whom have joined our call today, on behalf of volunteers and supporters for the agency, we all want to thank you, Governor, at the start for your heroic leadership during this state of emergency. And we, the coalition, I want you to know, stand with you, Governor, because just as Francesca beautifully described, our agency is committed to protecting those going through treatment for breast cancer and, of course, survivors. And we're going to make sure that those ladies and men are protected, that they're safe, that they get the health care they require, and that they have a huge safety net in their journey to recover and survivorship. So we stand with you, especially, Governor, during this state of emergency. And it's wonderful that we are taking time to recognize and be aware of breast cancer and the fight against breast cancer. Because, Governor, when I encounter the ladies, the men who have gone on this terrible journey, when I think back to my own mother who was felled by breast cancer, I know about resiliency. There's one word that combines all of us, is resiliency. And you know what, Governor? That's exactly what this state needs right now as we emerge from this state of emergency. So it's great that we're remembering the fight against breast cancer, but I would humbly suggest that the state ought to look to us, look to that secret word that all of us share, which is resiliency, as again, we seek to emerge from this state of emergency. Thank you.
Thank you very much, Ciro, and you're exactly right. Resiliency is so incredibly important as we respond to COVID-19. We listen to the scientists, follow the recommendations to make sure that everyone is safe. And one of the fundamental recommendations that they've made, which has been emphasized increasingly as the most important, is that we all wear masks. And we wear masks, we're told by the medical experts, not so much to protect ourselves, but to protect others from maybe transmission that we may be carrying without symptoms. And so as we think about our mothers, our sisters, the women and men who have experienced cancer, when we wear a mask, we are protecting them, more vulnerable citizens. And there's no better folks to be on this Zoom signing today than survivors of breast cancer. And we have 3 that we'll hear from, and another with who's has a pre-recorded video, who is fighting the fight once again. First up, we have a good old friend, Lois Wilkinson. Thank you for the work that you do as Program Director in Education and Survivorship at DBCC, and thank you for our many years of friendship.
Thank you so much for your kind words, Governor, and thank you so much for proclaiming October Breast Cancer Awareness Month. So as the Governor mentioned, I'm Lois Wilkinson. I live in Townsend, Delaware, and in 5 weeks, I will be an 18-year breast cancer survivor. I started working at the Delaware, thank you. I started working at the Delaware Breast Cancer Coalition over 16 years ago. And my goal was to give women the opportunity to talk openly about their breast cancer. Back then, it wasn't so open. So that was my goal, is to get people to open up, talk about their breast cancer, share their stories with other survivors, and get the emotional support they needed. Over the years, we at the Delaware Breast Cancer Coalition have added many support and educational programs that are all free to the public. This year, as Francesca mentioned, has been definitely extremely challenging due to the pandemic. But we were creative right from the start. We started working and just tried to see what we can do to help our survivors. And we came up with all of our programs. They've all become virtual. So we were able to transition quickly. And as a matter of fact, we didn't miss one support group. We had just had most of our support groups when we were asked to work from home. And then we quickly, thankfully, we had our Zoom meetings every month or every week with our DBCC. We knew what they were, so we were familiar with Zoom, so we were able to transfer all of our programs to Zoom rather quickly. And it allowed us to, as Francesca again said, reach more and more people as a result of that. But of course, there's nothing as good as an old-fashioned hug. And that's what our survivors crave. So we're looking so much, to getting this. Absolutely. The virtual hugs are nice, but just not quite as a real honest to goodness hug in person. So we're looking forward at the end of this pandemic, seeing all of our survivors again in person. And again, thank you so much, Governor, for proclaiming October Breast Cancer Awareness Month.
Thank you very much, Lois. Thank you for your team for really leaning into this issue and all the different implications during COVID-19, an incredibly difficult time, but one where these women and men need your help more than ever. So next up, we have Connie Holdridge, who's Program Director there in Education and Survivorship at DBCC. Thanks for joining us.
Thank you, Governor. As Ciro said, resiliency is our motto. I mean, it wasn't, but it is now. And we did go to everything to go on Zoom. And that just has made such a difference to be able to connect with people that are isolated. So I'm Connie Holdridge. I am the Program Director of Survivorship and Education in Sussex County for the Delaware Breast Cancer Coalition. I live in Lewis. I've been diagnosed with breast cancer 3 times. The first time was at age 45 with children at home. The last time was age 63 with grandchildren. I know the anxiety of being diagnosed with a potentially deadly disease, how it can overwhelm a person. That's why I started working for the Delaware Breast Cancer Coalition over 10 years ago, to help those diagnosed with breast cancer deal with their diagnosis on an emotional level. People, who understand and are more comfortable with their diagnosis and treatment options, or more likely to be compliant with their medical treatment plan. We bring survivors together to help each other in a multitude of ways, some fun, some emotional, some educational, but always supportive. As Lois said, we have not missed any support meetings since this pandemic started. Thank you, Governor. We really appreciate all that you're doing.
Thank you very much, Connie, and thank you for sharing your own experience and for the work that you do there in Sussex County. Next up, we have Amanda Perdue, again, a survivorship specialist with DBCC. Thanks for joining us as well.
Thank you, Governor. My name is Amanda Perdue. I am calling in from Magnolia, Delaware. I've been with the DBCC for 2 years now. The Delaware Breast Cancer Coalition recognized the importance of outreach for younger survivors. So I run our Young Survivor in Action program that focuses on our young survivors, and I also run our Yes to Health program. I am a breast cancer survivor myself. It will be 7 years this month. I was diagnosed with breast cancer when I was 28 years old. So you can do the math, I'm 35. So with our young survivors, our outreach, our younger survivors go through, different difficulties such as family, financial distress, careers, and this program focuses primarily on those issues and allows those younger survivors that extra support that they may need. So I thank you for having me here today.
Thank you very much, Amanda. Thank you for being part of the team and for helping get the word out for those that are affected by this terrible disease. So thank you to each of the survivors for turning your very difficult situation into something positive for other women and men, and to help advance the cause of fighting breast cancer here in our state. We will have other testimonials and videos that will follow this by legislators. We have a number of legislators who support this initiative and support all our work at Public Health to make sure that everyone in Delaware gets tested and gets the services and the health services that they need. So now we're going to move to the reading of the proclamation, as we do every year, most of the times in my office or my conference room in Legislative Hall. But this year, unlike any other year we've ever experienced, we do most of these things virtually. And we actually, at times, my guess is that we'll have more people that will see this video than would have been able to join me in my office. And so it is really a better way. It's not a very intimate way. It's not a way where we can, Lois, throw our arms around these folks that are experiencing such trauma, and again, but we can get the word out to a greater audience through this Zoom and this virtual session. So this is a proclamation in observance of Breast Cancer Awareness Month, and it reads, whereas breast cancer has impacted many individuals and families throughout our state and our nation, and whereas each October we recognize the importance of screening for breast cancer, as early detection is essential to treatment and recovery, and whereas we recognize survivors, we've heard three of whom today, for their incredible strength. We stand with those currently fighting, and we honor the memory of those who have lost their battle with breast cancer. And whereas this year, thousands of people have received screenings and have visited various outreach events, health fairs, and breast health presentations in Delaware. And whereas the Delaware Breast Cancer Coalition worked tirelessly to connect individuals with their programs and services over the last year. And whereas we thank Delaware's health organizations for their leadership in the fight against breast cancer, particularly the Delaware Breast Cancer Coalition. Now, therefore, we, John Carney, Governor, and Bethany Hall, Long Lieutenant Governor, do hereby declare October 2020 as Breast Cancer Awareness Month in the state of Delaware, and we urge all Delawareans to join in raising awareness of breast cancer, supporting our fighters and survivors, and encouraging early screenings and providing support for those impacted. The Lieutenant Governor has already signed the proclamation, and now so have I. And so October is proclaimed as Breast Cancer Awareness Month in the state of Delaware.
Thank you.
So thank you all for the great work that you do in our state and for joining us today. And we're going to now have videos from legislators and other survivors.
Hi, it's an absolute pleasure to be here sharing my story with you today. My family has lived in North Wilmington for over 5 years now, and I've been overwhelmed with a strong sense of community that greeted us. 4 years ago, while I was still breastfeeding my daughter Izzy, I was told that I had breast cancer. Less than 2 weeks later, we found out that my breast cancer had already spread to my spine, liver, and femur, which meant I had stage 4 metastatic breast cancer, or MBC, which has a life expectancy of about 3 years. Although I responded well to my drug treatments, in 2018 I had a breast cancer recurrence, which mutated to an even more aggressive subtype. In 2019, just days after participating in the Broad Street Run, I had a seizure which showed the breast cancer had spread to my brain. The same year, it spread to my lung, and just recently, I have had further progression to my spine and kidneys. We have not yet found a treatment to slow it down. Since 2016, I have had multiple surgeries, radiations, chemos, systemic drugs, and dozens of scans. I will be in treatment forever. This is obviously a difficult and overwhelming diagnosis for me and my family, which is why I have spent much of the last 4 years educating and advocating. October is an opportunity to focus on breast cancer awareness, and as a patient advocate, I like to remind our community how much more we have to learn, share, and help change. Personally, I like to refer to October as Breast Cancer Action Month. Consider these 5 important facts. Number 1. Dense breast tissue and cancer both show up as white on a mammogram, so it's critical that women get the right types of screening and diagnostic tools. 2. Only about 1% of breast cancer cases are men, but it is often missed because men are not looking for signs or getting screenings. 3. Breast cancer still kills over 42,000 men and women in the U.S. every year, or about 115 every day. Metastatic breast cancer is when the cancer has left the breast and spread to bone or vital organs. Number 4, Black women and white women get breast cancer at about the same rate, but Black women die from breast cancer 40% more than white women. Number 5, continued and increased research is the only way we will decrease deaths from breast cancer. My current treatment was just FDA approved in April of this year. More drug options, give me more time. I continue to look to my future with hope. For the last 2 years, I have visited my Delaware representatives in the Capitol to share my story and ask for legislative support. You can't imagine the pride I felt in August seeing a video of Senator Chris Coons on Facebook showing support of the Metastatic Breast Cancer Act. This bipartisan bill would waive the current 5-month waiting period for an MBC patient to receive Social Security disability benefits. It would also waive the 24-month waiting period to receive Medicare benefits. There is so much more to be done, but seeing strong leadership from Senator Coons and Governor Carney convinced me we are moving in the right direction. So thank you, Delaware, for being an ally.
Hello, I am Senator Nicole Poore, and I'm proud to be a part of this virtual proclamation signing, recognizing October as Breast Cancer Awareness Month. Events like these are so great because we not only recognize the many Delawareans who have battled breast cancer, we also encourage our neighbors to be proactive about the importance of screening and early detection. We know that when breast cancer is detected early, there is a much higher rate of survival. And I want to stress the importance of conducting monthly self-exams and scheduling routine clinical breast exams and mammograms. I also want to thank Delaware Breast Cancer Coalition for their crucial work they do to promote early detection and treatment of breast cancer. And thank you to the many healthcare professionals working tirelessly in the middle of a global epidemic to make sure that individuals still have access to life-saving treatments.
There are over 200,000 breast cancer diagnoses every year, and 1% of those diagnoses are men. So right now, during Breast Cancer Awareness Month, I challenge you to get to know your body so that if you see something different, you can say something. Early detection is key. So I challenge you to 3 things. Get to know your body, tell someone else about breast cancer awareness, and if you see something, say something to your doctor right away.
I'm Molly McGarrick, Secretary of the Delaware Department of Health and Social Services. Today I join Governor Carney and Lieutenant Governor Hall Long as they raise awareness about breast cancer, show support for the fighters and survivors in Delaware, and encourage early screenings. The earlier breast cancer can be detected, the more effectively it can be treated. Mammograms remain the most effective screening test to detect breast cancer. Annual mammograms for women over 40 can catch many breast cancers in their early and most treatable form. If you're uninsured or underinsured, you may be eligible for a free or reduced cost breast cancer screening through the Delaware Division of Public Health Screening for Life program. Call the Delaware Breast Cancer Coalition at 1-888-672-9647 for more information. Thank you.